infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to today's show. Vermont Senator Bernie Sanders has been the country's most outspoken advocate for a Medicare for all, single-payer healthcare system. He often pushes for a Canadian-style healthcare system, and he's not alone. A lot of his followers do the same. But when you look at his website, you can get a good bird's-eye view of what he's actually proposing. His universal single-payer healthcare system means to him, essentially, comprehensive coverage for all Americans. And we're talking about everything, inpatient to outpatient care, and preventive and emergency care, primary care, specialist, long-term care, eye exams, hearing, dentist, prescriptions, and it goes on and on. It's essentially this massive Cadillac plan. So how does Bernie Sanders' vision of single-payer healthcare compare to the current Canadian healthcare system? Well, my guest today, though clearly not an advocate of the Canadian-style healthcare, explains the differences and why the Sanders plan is actually worse than Canada's current plan in a recent article. So joining me now is Ryan McMaken. Ryan is the editor of Mises Wire and the Austrian with the Mises Institute. Hey, Ryan, welcome to the show.
Hi, good morning.
All right, well, I described how Sanders wants to do his healthcare plan, hugely expensive, take care of everything kind of plan, a Cadillac plan of sorts, paid for by the government. So what do we actually know about how the Canadian single-payer system works, and how is it different from what Sanders is proposing?
Well, let's start with what Sanders is proposing, which isn't entirely clear if you go to his website. I don't know if it's purposely vague, or maybe they don't understand it. It's called, of course, Medicare for All, implying that this would just be an expansion of Medicare, how it's currently done. But Medicare in America is not a single-payer plan. But then if you read down on the Bernie Sanders plan, it says we would create a single-payer plan for the United States that would cover all of this. So is it single-payer, or is it Medicare, U.S.-style Medicare? That they seem to conflict with each other. But let's take them at their word that they want to create a single-payer plan. The model then, of course, is that they frequently cite is Canada, which is a single-payer plan in the sense that there are medical services, certain medical services on a big list, if you will, only have a single payer, which is the government. And so anything that's on that list then is provided by what's confusingly called Canadian Medicare. It's also called Medicare in Australia, so we'll try not to get confused. But Canada style. And so anything on that list can only then be provided by the government under most circumstances. And you can't just go up and hang out your shingle and set up shop providing that in the private sector. And which, of course, you can, if something's offered in Medicare here, you can go supply it in the private sector too. But it's very different in Canada, where you're not allowed to compete with the single-payer system. And what a big difference you notice immediately then is if he's shooting for a Canada style, and at the same time offer all these services that they say they want to do on their website. So it's everything from long-term care to mental health to dentistry to eye exams. All of that stuff is what the Sanders plan calls for, either unaware or just ignoring the fact that Canadian Medicare, Canadian single-payer system, doesn't cover a lot of that, certainly not in the federal legislation. So the federal legislation, especially as updated back in the 80s, doesn't provide coverage for mental care. It doesn't, unless it's performed by a doctor in a hospital. It doesn't provide pharmaceutical coverage, for example. It doesn't provide long-term care. Now, some of that is covered at the provincial level, where the provinces have put in place programs that cover that or have defined those things as necessary to get some funding from the feds. But this is hardly the sort of blanket coverage that is requested and claimed is going to happen under the Bernie plan. And so this is part of the reason, of course, that Canadian government spending isn't completely out of control. It's because they greatly limit what is actually covered and mandated to be covered in their federal Medicare legislation in Canada. So if the Canadians were to start doing what Bernie wants to do, which is covering everything, then costs would absolutely skyrocket immediately, and they'd be facing a serious, serious debt problem. And then that's what Bernie wants to do here then, is just expand to covering everything.
Exactly. And I'm sure most Americans don't even realize this. And other than the amount of spending, why are these differences important for other reasons?
Well, of course, single payer is really one of the worst types of universal coverage, and that's what a lot of people don't realize, is that universal health care and single payer health care are not synonyms. They're not the same thing. There are other types of systems you can use. There's the Swiss system, which superficially actually looks quite a bit like Obamacare, in the fact that everybody's required to buy insurance and that there's just a highly regulated market on the side. There's the German system where above a certain level of income, you're required to buy private insurance, and then below a certain level of income, you just go on what's essentially a government insurance program. There's Australia's Medicare system, which is basically a parallel private and public system. They had privatized part of the system to help take the pressure off wait times that were, of course, long when they had only the public system. And so there are all these different sorts of issues. And not all universal coverage systems are equally bad, and single payer is one of the worst because it basically outlaws private sector competition in most ways. But even worse than the Canadian system, however, is the British system, the National Health Service system, which has basically government-owned hospitals.
Right.
And everyone receives their treatment in these government institutions, which are then known for poor outcomes and for long wait lines. They point to life expectancy and things like that, but life expectancy really is mostly dependent on many other things, such as population, obesity, and drug use habits, and automobile accidents, and all that sort of stuff. Trying to connect that just to your health system doesn't really work. Which, if you look at specific disease outcomes and things like that, the National Health Service is starting to have some real problems there. But the larger issue is freedom, too. I mean, you're not even allowed then to purchase these goods in the private sector. And I wonder how much Americans would like that, where they wouldn't even have the option then of buying these things. I think most Americans love the idea of some sort of universal coverage. There's like a safety net, right?
Right.
And of course, the U.S. is moving in that direction rapidly now. It's now 138% of poverty rate. You're on you can qualify for Medicaid. I guarantee you within 10 years, it's probably going to be at 160% or so, which is what food stamps is at now. Probably within the next 20 years, it's going to be at like 300% of poverty rate, which is what the Massachusetts plan did under Romney. So it's just a matter of time. So you got basically this huge safety net and near universal health care. But the last thing you want, though, is a single payer type system which basically outlaws private competition and a private sector in healthcare.
Right. And the irony is that some Canadians actually want this Bernie style plan, and they criticize the current plan. Any thoughts on that?
Well, yeah, it's assumed by Americans. It's this weird thing Americans and Canadians have. Canadians think that Americans are like dying in the streets because they can't afford health care. They think that like the paramedics, before they'll help you, will make you show your insurance card or provide them with a credit card in order to receive care of any time, of any kind. They actually think this is a real thing where you have to like flash the cash before you can receive any health care in this country. And then at the same time, Americans think everything is perfect and everything is covered, that you never even have to worry about like a single bill in Canadian healthcare. This isn't true at all. There's lots of private coverage that has to take place. In fact, Canada has 30% private sector healthcare spending, which is higher than most countries in Western Europe. And so you have this raging debate right now among Canadians, as they want, some left-wing Canadians want to greatly expand to pharmaceuticals and to mental health and lots of other issues. But there's the problem of, unlike the U.S., since the Canadian dollar is not this global reserve currency, they can't just keep printing money
right.
ad nauseum and just go deeper and deeper into debt like Americans can. So they realize that there are limits to how much you can spend on this stuff. So they've so far, in the last 20 years of attempting to greatly expand this coverage, have failed.
Okay. Ryan, any final thoughts on this topic?
No, I wrote the article because I was just peeved by the fact that everyone was speaking of Canadian healthcare in ways that really didn't describe what was going on, and acting like all universal coverage systems were Canadian-style single-payer systems, and that's just simply not the case. So it's a lot more helpful to actually look into some of this and be able to tell the difference between the different systems.
All right, it's a good article. I'll go ahead and post a link to it on the website when I post the podcast. And I want to thank you, Ryan McMaken, for your time and your expertise, sir.
Great. Thank you very much.
You bet.